back in Washington, D.C., and let me have you introduce yourself.
Yeah, I'm Dr. Carolyn Muller from the University of New Mexico and board of directors of the Foundation for Women's Cancer.
We are obviously learning a lot about ovarian cancer, a lot of research going into it right now. One of the most important things is what kind of treatment women get when they first are diagnosed. What's the most important thing as a woman is first diagnosed with ovarian cancer or even has a suspicious mass?
Yeah, if a woman has a suspicious mass, then it's very important that if there's an idea that it might be ovarian cancer, that she see a gynecologic oncologist, because all of our data show that outcomes are much better when women are initially diagnosed and treated by a gynecologic oncologist.
Perfect. And when women are in that, what are some of the first questions they should be asking of their doctor when they are maybe first getting to a gynecologic oncologist? What are some of the things they should ask of their doctor, just to kind of, and their caregivers should be asking as they go through their first few months of treatment?
Well, clearly there's a lot that evolves over those first few months, and the questions are enormous. Women should always feel like they can ask anything of their gynecologic oncologist. They typically need to know what their treatments are, what the goals of those treatments are, what to expect from the treatment, what kind of side effects, and most importantly, what the outcome is supposed to be. We all treat for cure, and it's very, very possible.
Women who are fighting these diseases, it's important for them to consider clinical trials. Tell us a little more about what clinical trials are and why every ovarian cancer patient should at least consider being involved in one.
Yeah, clinical trials are extremely important, especially for ovarian cancer, because over the years we've seen participation in clinical trials actually change how we practice and better how we practice. Women do so much better now with ovarian cancer than they have decades ago, mainly because of clinical trials. So I would strongly encourage women to ask their doctors about clinical trials, participating in them, because the next latest and greatest thing is just around the corner.
One of the greatest obstacles for women getting involved in clinical trials is they kind of feel like if they aren't in the main treatment wing that they'll be getting a placebo or something. Can you help ease women's mind about clinical trials and what really happens when they enter into a clinical trial?
Well, there's many levels of clinical trials. Some are placebo, have a placebo component to them. Many of them are randomized. But the bottom line in clinical trials is everything has got to be at least standard of care, if not better. So there is absolutely no worry that, oh my God, I might not get anything, because the standard of care level will be there, plus a placebo or not, or plus the next new drug or not.
As your passion for ovarian cancer, treating women with ovarian cancer, what excites you the most right now about the scientific breakthroughs that are happening, or what you really hope happen in the next few years for ovarian cancer patients?
Yeah, it is an incredible time right now in the ovarian cancer world, because we have got so many new drugs. We're understanding the disease a lot better, a lot more about the mechanisms, and we have a lot of targeted therapies that I have no doubt that we're moving more towards personalized medicine, and in the next decade, we're going to make so many advances, not only just from the curative side, but from the side effect side, and it will be a lot easier to treat these women.
Thank you very much. Have a great day.